In recent weeks, the world has once again heard the word hantavirus, after international health agencies monitored new cases linked to a cruise ship outbreak involving the Andes strain of the virus. While experts say the overall public risk remains low, the outbreak has reminded people everywhere that dangerous diseases can emerge from unexpected places. But what exactly is hantavirus? How does it spread? Why can it become deadly? And most importantly, how can ordinary people protect themselves? Hantavirus is not a single virus. It is actually a group of viruses naturally carried by rodents. These viruses belong to the Hantaviridae family and exist in many parts of the world. Different strains are linked to different rodent species. In most cases, the rodents themselves do not become sick, but they can spread the virus to humans. According to the World Health Organization, hantaviruses are found across the Americas, Europe, and Asia, causing serious disease in humans when transmitted through infected rodents. The disease first gained worldwide attention in 1993 after an outbreak in the southwestern United States killed several healthy young adults. Scientists later traced the infections to deer mice carrying the virus. Since then, cases have continued to appear in different parts of the world, especially in rural areas where humans come into close contact with rodent populations. The virus spreads mainly through contact with infected rodent urine, saliva, droppings, or nesting materials. When these materials dry out and become disturbed, tiny virus particles can enter the air. A person may inhale them without even noticing. This is why cleaning abandoned buildings, dusty cabins, garages, basements, farms, or storage rooms can sometimes become dangerous. Many infections happen during simple daily activities such as sweeping floors covered with mouse droppings or cleaning old buildings without proper ventilation. One important fact is that hantavirus is not usually spread from person to person. According to the World Health Organization and the U.S. Centers for Disease Control and Prevention, almost all infections come directly from rodents. However, there is one rare exception known as the Andes virus strain found in South America. Limited human-to-human transmission has been documented among close contacts, especially family members or intimate partners. This rare possibility is one reason recent international outbreaks have attracted global attention. Yet experts continue to emphasize that hantavirus is very different from COVID-19 and is far less contagious. The symptoms of hantavirus often begin like the flu, making early diagnosis difficult. A person may develop fever, headaches, muscle pain, fatigue, nausea, vomiting, or abdominal pain. At first, many people assume it is a common viral illness. However, in severe cases, the disease can suddenly become much worse. In the Americas, hantavirus can cause a condition called hantavirus cardiopulmonary syndrome, also known as HCPS. This severe illness attacks the lungs and heart. Patients may suddenly develop coughing, chest tightness, and difficulty breathing as fluid rapidly fills the lungs. Some patients go into shock. According to the World Health Organization, the fatality rate in severe HCPS cases can reach up to 50%. In Europe and Asia, different hantavirus strains can cause hemorrhagic fever with renal syndrome, or HFRS. This form mainly affects the kidneys and blood vessels. Patients may experience internal bleeding, low blood pressure, kidney failure, and severe fluid imbalance. One of the most frightening aspects of hantavirus is how quickly it can progress. A patient may appear stable in the morning and struggle to breathe by evening. Doctors say early medical care is critical because there is currently no specific cure for hantavirus and no widely available licensed vaccine. Treatment focuses mainly on supportive hospital care, including oxygen therapy, breathing support, and monitoring heart and kidney function. Diagnosis can also be challenging because the symptoms resemble influenza, COVID-19, pneumonia, dengue, or other infections. Doctors rely heavily on patient history, especially possible rodent exposure, travel history, or contact with known cases. Laboratory testing such as antibody tests and PCR testing helps confirm the infection. Health authorities continue monitoring hantavirus activity around the world, especially after recent cases linked to the cruise ship MV Hondius raised concerns about possible Andes virus transmission. Some infected passengers required special transport and monitoring, although officials repeatedly stressed that the overall public risk remained low. Even though hantavirus remains relatively rare, scientists warn that environmental change, urban expansion, climate conditions, and increased human contact with wildlife may influence future outbreaks. Growing rodent populations in some regions can also increase exposure risk. This is why prevention remains the most powerful defense against the virus. Experts recommend avoiding direct contact with rodents and their droppings, sealing holes where rats and mice can enter homes, and storing food in tightly closed containers. Health experts also strongly warn against dry sweeping or vacuuming rodent droppings because doing so can push dangerous virus particles into the air. Instead, contaminated areas should first be sprayed with disinfectant or bleach solution and allowed to soak before careful cleaning with gloves and protective equipment. Ventilation is also important when entering closed spaces that may contain rodent waste. Cabins, barns, sheds, warehouses, and abandoned houses should always be aired out before cleaning begins. Hantavirus reminds the world that some of the deadliest diseases are not always the most famous. Sometimes danger hides quietly in places people rarely think about, in abandoned buildings, dusty corners, farms, forests, and rodent nests. The good news is that knowledge saves lives. Understanding how the virus spreads, recognizing symptoms early, and following safe cleaning practices can dramatically reduce the risk of infection. As scientists continue studying hantaviruses and global health agencies monitor new outbreaks, the world is reminded once again that public health vigilance, scientific research, and accurate information remain essential in protecting human life.